everyone, and good evening. My name is Afe Ogre. I'm a PMHUP student here with Regis College. Today, we're talking about an important, fascinating chemical called serotonin. The serotonin is also called 5-hydroxytryptamine or 5-HT. It is much more than just a feel-good neurotransmitter. Serotonin plays an important role in everything from sleep, appetite, memory, and mood. First, let's talk about what serotonin actually does in the body. This involves a wide variety of essential functions. It helps balance our mood, which is why it's closely linked to depression and anxiety. It also helps with sleep, helping us regulate our internal clock and sleep-wake cycles. Serotonin also affects our appetite, and it helps us know when we're full and when we're hungry. And finally, serotonin helps with pain perception, sexual function, body temperature regulation, and it helps us think clearly. Now let's look at what happens when serotonin is out of balance. When serotonin is too low, the patient will have depression. When serotonin is too high, the patient will have serotonin toxicity. Now let's look at where serotonin lives in the body. Inside the brain, serotonin is mainly produced in a region called the raphe nuclei, located in the brainstem, with the dorsal raphe nucleus being a big proponent of serotonin production. From there, it is sent to many areas, including the cortex, the limbic system, the spinal cord, where it regulates mood, emotion, and motor function. Here's something surprising about serotonin. 90% of serotonin isn't found in the brain, but is actually in the gut. It is made by specialized cells in the gastrointestinal tract and stored in platelets, where it plays a major role in digestion and blood clotting. Serotonin can do different things because it connects with many different kinds of receptors. Here are some of those receptors. 5-HT1A and 5-HT1B receptors are involved with mood and anxiety. 5-HT2A and 5-HT2C have more complex roles, which include emotion, appetite, and even affecting patients, causing hallucinations. 5-HT3C shows up in the gut and brain, and they're linked with nausea and vomiting. Finally, 5-HT4 through 7 have roles in learning, memory, gut movement, and regulation of our body's internal clock. Now let's talk about how we treat serotonin imbalances. To increase serotonin levels, doctors often prescribe a class of medication called selective serotonin reuptake inhibitors, or SSRIs. They work by stopping the brain from reabsorbing serotonin too quickly, leaving more of it available to do its job. The common SSRI is fluoxetine, better known as Prozac. On the other hand, if someone is experiencing too much serotonin, like in serotonin syndrome or serotonin toxicity, we need to block serotonin's effects. This is where serotonin antagonists come in, especially those that block the 5-HT2A receptors. A good example is the cyproheptadine or periactin. It helps calm the body down by preventing serotonin from activating certain receptors. To wrap it all up, serotonin is a powerful neurotransmitter with a wide-ranging effect on the brain and the body. It helps with regulating mood, sleep, appetite, memory, and more. It is produced in the brain's raphe nuclei, but most of it actually lives in the gut. It interacts with several types of receptors, each playing a unique role. Deficiency in serotonin causes depression and anxiety, while too much can lead to serotonin syndrome. Medications like SSRIs can boost serotonin, while drugs like cyproheptadine can reduce serotonin. Thank you all for listening to my presentation video, and have a good evening.